Hi, everyone. It is so great to be here with all of you today. My name is Tina Marie Stoltz, she, her. I'm the Assistant Director of Campus Ministry. I'm here on Hawk Hill. And so I'm so excited to be here with you today for this healthcare and Jesuit mission panel, which is really exciting. Another really exciting thing is my sister is in labor. So I will have my phone on me just in case, but I just want to let you know, if you see me on my phone, that is why. I would never do it otherwise. So thank you all so much for coming today. It is so exciting to be here with you. And so we're going to jump right in to our program. There it goes. Quickly, I don't know where it went. The questions. Oh, great. Thanks, Eric. All right. So healthcare and Jesuit mission, we're going to fly through this. But if you have any questions, you can throw them in the chat, okay? So first is first. We're going to go through really quickly, who is St. Ignatius? What is a Jesuit? And then what are Ignatian values? And then we're going to get to our wonderful panelists about why this really matters in healthcare. All right, so this is St. Ignatius of Loyola. Really quick, a little bit about his story. He was a pretty cool guy. He was born in Spain. He had a lot of siblings. This is a modern day view of where he lived when he was living in Spain. His whole life was really wine, women, and war. That was kind of who this guy was. Those are like the three things that he really cherished. That was what he surrounded his life. That was what he surrounded his life on. Until one day he went to war at the Battle of Pamplona, and he got knocked in the leg, in the knee with a cannonball. Just absolutely knocked. And to all the medical people in the room, you know, they did not have anesthesia back then. So that was really painful. And so he spent a lot of time healing in a room by himself. And as he did not have TikTok or Instagram, he had two books. One was about the life of Christ and one was about the life of the saints. And what he started to realize as he was doing this was when he would think about wine, women, and war, it would make him like happy, but it would be fleeting. It would go away. But when he started thinking about deeper things, when he started to think about the world, when he started to think about his connection with the universe, when he started to think about his connection with God, he felt like that was lingering with him longer. It was sustaining him longer. Fun fact about St. Ignatius, he was very vain during this process. And so his leg kind of healed a little bit crooked. So he had them re-break it and set it again so that he would look better in his like outfit at the time, which again, medical people in the room, no anesthesia. So that's kind of where this guy was coming from. But it's through this healing process that he has this really big change of heart. And so when he leaves this room that he was recovering in, he goes to a church, he lays down his sword, right, laying down violence, and he takes off his noble robes and he puts on the robes of a person who is in poverty, and he just gives his life to something else, something different. And so he ends up going to the University of Paris, and it is there in his dorm room that he meets his new friends, and they become the first Jesuits. He shares his ideas with them, his values, and all of his thoughts, and that is how the Jesuits started. I think as a Jesuit educator, at a university, that always gives me such inspiration that like college students really can do really great things. And so what are Jesuits? So the Jesuits, like if someone is a Jesuit, right, they are the religious community called the Society of Jesus. So they're priests, and they're called the Society of Jesus started by St. Ignatius. If anybody knows Dan Joyce, if he's watching right now, the students call him DJSJ, Dan Joyce, Society of Jesus. So that's where we get that from. And so The great thing about the Jesuits that I really like is that they are committed to the service of faith and the promotion of justice, which I think is very important, right? Especially when it comes to healthcare. And so Ignatian spirituality, right? Ignatian, like the word Ignatian. So like I would say I'm Ignatian, but I'm not a Jesuit, as I am not a priest. So the word Ignatian really refers to the spirituality or the teachings or the traditions inspired by Saint Ignatius. And all of those things are really accessible to everyone, right? Active reflection, thoughtful decision making, seeking purpose in everyday life. That is really what being Ignatian and the Jesuit mission is all about. And again, the Ignatian values can be embraced by anyone, regardless of religious affiliation or no religious affiliation, as a way to grow and find deeper meaning. And so I like to just emphasize there are many doors to enter the Ignatian house. And so everyone should feel very, very welcome. There's lots of room inside the Ignatian house. And so St. Ignatius comes up with this idea. He calls it God in all things. And what I love about God in all things is that he thought of it as he was laying out under the stars, which I think is really, really beautiful. And so if the word God doesn't resonate with you, sometimes we use the word God or we use the word divine. If that's something that doesn't resonate with you, I want you to just find your capital word. Like, what is your capital word? What is something that reflects a reality that's larger than you, but then also a connectedness? Some people call it God. Some people call it good or love or sacred or divine or creator or Allah or mystery or universe. So whatever your sacred, your capital word is, cling on to that as we talk about our Ignatian values. And so as we go into what our Ignatian values mean today, I want to read a quote about Ignatian spirituality from David Fleming, SJ, Society of Jesus. And he says, Ignatian spirituality is not captured in a rule or set of practices or a certain method of praying or devotional observances. It is a spiritual way of proceeding that offers a vision of life, an understanding of God, a reflective approach to living, a contemplative form of praying, a reverent attitude to our world, an expectation of finding God daily. So essentially, Ignatian spirituality is all about this way of living, right? This way of being that helps us be in connection with ourselves, with the divine, and also others. And so a couple cool things about Ignatian spirituality and why it is applicable on today's topic. Ignatian, and this is why I like Ignatian spirituality. I can't do like super meta spirituality. I need something that's practical and adaptable. This is what I need. So Ignatian spirituality is very practical. It's very adaptable. It's an outlook. It's not a program, right? It's a set of attitudes. It's not like rules or a scheme. And at its heart, Ignatian spirituality, there really is a profound humanism that really respects people's lived experience and honors the vast diversity of the divine's work in the world. So that's why Ignatian spirituality has so many doors, because you bring yourself as you are to it. And as we say in the tradition, imago Dei, made in the image and likeness of God. So, this is where we get our Ignatian value, our Jesuit value of cura personalis, or care for the whole person. And I know that from the Lancaster campus that there's been a really big emphasis on, right, this whole person care, and U City, right, this whole person care, which is very much care for the whole person. I just think like that's so beautiful, and it's like getting at such an important truth. Another way to think about cura personalis, another way that I like to think about it is Jesuit intersectionality, right? So knowing that we are not just one thing, we are many things all at once, and those things pile on top of each other for good ways and for ways that that make navigating our world as is a little bit difficult. So an example of this would be like a patient who's elderly, but maybe they also don't have family or close friends. That's some intersectionality there, what's going on there. Or a patient who has a physical disability and English is their second language, right? That's caring for that patient is going to look different than if English was their first language. And so we take all of who people are. And we see them all as we looked up in this other slide, imago Dei, right? Or made in the image of God. And so another Jesuit motto, this is one that I personally love and I really just wanted to share because it really does make me think about a lot of the work that you all do in the medical profession and some of the work that we do over here in campus ministry is that in todo amar y servir, in all things love and serve. And sometimes I need that little motto to get me back to what is the mission? What am I doing here? And I always go back, amar y servir, to love and to serve. And so does anyone have any questions on that before we jump into our panel? Okay, great. Excellent. Okay, awesome. And so without further ado, I would like to introduce you to our panel. So first up, we've got Freddie Abud. He's a senior undergrad, senior fellow at the Institute of Clinical Bioethics. Give us a wave, Freddie. Awesome, great. We have Jessica Haddad. She is a senior researcher and fellow at the junior biology major. We have Nicole, who is a patient, Nicole Comer, who's a patient safety specialist and MSN nursing major. And we have Sage Olnick, who's the academic success coach and adjunct faculty. So a little bit about each of them. So Freddie, he is a junior biology major and serves as a coordinator of local community health initiatives run by the Institute of Clinical Bioethics. As an inspiring physician, Freddie aims to live up to the Jesuit values as he works alongside the ICB staff to bridge the gap between underserved communities and medical care. Thanks, Freddie. That's awesome. Jessica, she is a senior undergraduate research fellow at the Institute of Clinical Bioethics, and she aspires to have a future in dentistry, which is awesome. So cool. Since her sophomore year, she's been actively involved in bioethical research and volunteering with the Health Promoters Program, providing care to underserved communities. Through her work, she applies Jesuit values to healthcare, hoping to inspire future providers in medicine, dentistry, nursing, and related fields to become compassionate, ethical advocates for positive change. Awesome. We have the best students in the world, don't we? I mean, I don't think that's up for debate. I think that's pretty clear. And then we have Nicole. So Nicole is a patient safety specialist at Penn Medicine Lancaster General Health. She started her nursing career in the heart failure unit, later transitioning to assistant nurse manager for the float pool team, then to nurse manager of the inpatient oncology unit for taking on her current role in 2023. Nicole has completed her associate's degree in nursing, bachelor's in nursing, and is currently pursuing a master's in nursing administration from St. Joseph's University. That's important work. All of that's such important work. And then we have Sage. Sage serves as an academic success coach for the Bachelor of Science of Nursing students at SJU. Since beginning her nursing career in 2005, she has cared for diverse patient populations and acute care, ambulatory care, and home hospice. After witnessing the burdens of compassion fatigue and burnout of colleagues across healthcare disciplines, she shifted course to focus on the well-being of nurses and other healthcare professionals. She obtained a Master's of Divinity degree and was ordained as a Unitarian Universalist minister and board certified by the Association of Professional Chaplains. Additionally, she is an adjunct faculty and honored to serve as co-chair for the Day of Dialogue. Sage, such important work caring for carers from a place of understanding and not just a place of imagining. So thank you all so much for being here today. So now we're gonna jump into our questions. So could you each share a little bit more about your position and what the primary functions of your job are? Sage, would you like to kick us off?
I would love to. So as an academic coach who works specifically with nursing students, BSN students, I really see my job as first and foremost relational. Like who students are as whole people. So developing relationships with students. So that might look like meeting with them individually to talk about, things like study strategies and test taking tips, or it might look like how to cope with hard things. And also it might look like a group coaching session or a classroom presentation. So yeah, honored to do it. And really it's about helping students get what they need to be academically successful and to grow into their professional identity as a nurse.
Thank you, Sage. How about you, Jessica?
Yes, so my role as a senior undergraduate fellow, I help coordinate all the dental supplies, all the goodie bags, the dental students, the dentists, and we provide preventative care to the underserved, undocumented population of Philadelphia. And that would include volunteering each month at the consulates of Guatemala and Mexico located in Philadelphia. Also coordinating monthly journal clubs to help fellows understand more ethical processes, develop ethical reasoning when dealing in healthcare environments, and especially, additionally, I also do dental assisting, so that also contributes to my experience in dentistry and overall helps me get in the clinical experience as well.
Nice, awesome. How about you, Nicole?
Hi, everyone. Thank you so much for having me. So my job is a little bit interesting, probably something that most people don't know it's a job. But I actually conduct investigations when events occur at our hospital. So basically, if something goes wrong, an example is a wrong side surgery or any event that would have caused a patient harm or potential harm, we have a team that investigate that. I'm sorry, my cat is probably gonna make a cameo over here on the left. So I apologize beforehand. But so I work with other team members, including our patient safety officer. And what we do is we investigate the event as a group of people who were not involved. So it allows us to look at it from an outside perspective. But I'm working with staff members, right? So individuals who might have been involved in an event that could have been also equally detrimental to them because, maybe they made a mistake that was catastrophic. Um, so it really ties into caring for those individuals in the sense of like, yes, you're working in a system that will lead to errors, but how do we take care of our providers and our staff when that happens? And how do we, A, get the information so it doesn't happen again, but also how do we take care of them as people?
There you go. Whole patient care on all ends there. How about you, Freddie?
First off, thank you for having me here today. Just as Jessica is, I serve as one of two senior undergraduate research fellows at the Institute of Clinical Bioethics. Like just a little background, so the Institute of Clinical Bioethics, or ICB for sure, it's a place where we merge undergraduate scholarly work with clinical outreach. So my job is essentially twofold. I first have the research work, so I work alongside physicians and healthcare professionals in the Philadelphia area on research projects that essentially investigate the ethics behind medical devices, medical practices, and it spans the spectrum from addressing the current opioid epidemic to investigating the ethics behind xenotransplantations. So it's very broad research perspective. And my second responsibility is to help oversee the health promoter program that Jessica touched on. So it's a community health equity initiative. It's founded on the philosophy of preventive medicine, and we essentially have medical clinics that we run monthly throughout the Philadelphia area to serve the underprivileged, underinsured, uninsured communities here in the area. We serve diverse populations. We have the BIPOC, the Hispanic, the Asian, the African communities in the Philadelphia area. And I also involved in I attend medical ethics teaching rounds, ethics committee meetings at hospitals throughout Philadelphia. So I've had the privilege and for being at the ICB for quite some time now. So that's it.
Excellent. Thank you all so much. So what drew you to the profession? Why don't we start with the overgrads and then we'll do the undergrads. Just kidding. How about we go Nicole and then Sage, and then afterwards we'll go Jessica and then Freddie.
So to the nursing profession, I would say I was actually accidentally drawn into nursing. I had signed up to go to, and Sage has heard this story many times, but I had signed up to do sonography because I needed a way to pay for art school, right? So I wouldn't be a starving artist. And then my friend was like, well, you should just switch to nursing if you're just gonna go to school for that. And here I am, still a nurse. So I ended up falling in love with it. It really appealed to my sense of being able to care for people, and I didn't know that then, or didn't ever picture myself in that in this profession, because I didn't really have any, I didn't know anyone in my life that was a nurse. And if you are from, like, I'm from Dominican Republic, and a lot of the times nursing is not in the same level as elevated as it is here in the United States. So that's what drew me into nursing. But patient safety was also something that found me. And I had some great leaders who had, seen that this is something that I would potentially be good at. And when I learned more about the position and what it entailed, I really liked the idea of, similar to what Sage had mentioned, of caring for the providers and caring for the staff. And having been on the other end of an interview in the past where, an event happened with one of my patients, I understood the stress level that comes with staff having to meet with, a risk manager or a safety specialist to discuss a potential event. And being able to be that person that sets, the tone and keeps people calm during an event that could be very challenging, really appealed to me. And I'm a very relational person, really want to make people comfortable and have good conversations. So I think it just really fits with the person that I am and my skill set. So that definitely drew me into it. And from an equity perspective, it's a field that you don't see a lot of diversity in, as I've come, more and more. And I'm always happy to be the one to break down a barrier and, bring a different perspective whenever possible.
Thank you. How about you, Sage?
Yeah. So I can't believe, but I've been an RN for a couple decades, which is just wild. So I think my understanding of like my calling to the profession has sort of shifted over time. But a first generation college student, neither of my parents went to college. Kind of just sort of knew that I was fascinated by the human body and disease processes, and I knew that I really wanted to serve my community. So I became a nurse. And then I think I've stayed in the profession because I've experienced it and I've seen it over and over that like nurses really change lives. I know you mentioned Tina Marie, your sister's in labor right now. I have no doubt there's a nurse with her at the beginning of this life and all the way through. And a nurse can make it the best that it can be, along with other healthcare professionals, especially those in the group, the best that it can be, at the end of life. So I think for me, it's also about meaning making and purpose and really finding a way to make a difference to help people heal. And if a cure isn't an option, it's an honor to be with people to make it the most meaningful that it can be. There's always space for healing. And maybe we'll get to this later on, but I think as I find myself now in nursing education, it is such an incredible honor and privilege to help shape future nurses and to support them on their way. Just knowing all the lives that they are going to touch and make a difference. So yeah, I think it's changed and shifted over time, and nurses are lifelong learners, so that might shift and change again.
Thank you so much, Sage. And then we'll go to Jessica and then Freddie.
Yeah, so great stories. What drew me to dentistry, or the road to dentistry? So it began since I was a kid. My father was a dentist and he would spend long hours in the clinic. And I never understood why he did it, but I would just agree with it and always do everything with my mom. And growing up, it was mostly my mom taking care of me, driving me to school back. So I never really saw what he did until I got older and I started going with him to the clinic and I shadowed him and then I was working. And it was a privilege just to see what he did to others and how he impacted them beyond just physical work in the dental chair. He improved their quality of life and everyone that was facing either fear, pain, he made it better and always provided long-term impact by the relationship he made with them. And that was really important to me and how I saw him get that patient care, but then also improve their quality of life at the same time. So it was both an experience in that, and it later then went to high school and college where I further solidified my knowledge and determination to become a dentist, where I've worked with immigrants, I've worked with undocumented people, I've worked with Africans. We went to blueberry farms in Hamilton, and I had to speak French to people that only knew Creole. So it's an experience where I could use my abilities that I've learned from my parents to contribute to others and also provide fluoride treatments and really the all-person kind of care. And I hope to do that in the future as well and just give back to the community.
Yeah. How are you, Freddie?
For me, I think up to this day, my love for the medical profession has grown gradually. So ever since I was admitted for a cystronic procedure in first grade, I think I've been drawn to the medical profession, especially physicians' work. From an educational perspective, I think I'm very intrigued by the human body, its physiology, the complexity, its potential, its durability, and that's all what physicians research and study extensively. I think intellectual curiosity is another thing that I'm really drawn to, and that's required in the medical profession of all practitioners, and especially in diagnostics and clinical pharmaceutical research, and even listening to patients. So I think that's these like intellectual demands, like they align with my desire to grow cognitively and personally. And also the medical profession, like as in terms of physicians, they bring something different to the table. They can they have the ability to lead medical teams. They can handle surgical teams, triage patients, declare patients incompetent. So they have lots of authority. And I think the relationship that physicians develop with patients is unmatched. The American Medical Association describes the physician-patient relationship as a fiduciary relationship, and there are double standards. Just as you expect the patient to be honest, just as a physician would expect the patient to be honest, so does the patient expect the physician to act with beneficence and non-maleficence. So I think there's the double standards also draw me to the profession. And the medical degree and MD degree would allow me to extend my experience in the future to developing countries, to help address the disparities in medical care in developing countries. And that's a mission and a cause I look forward to help resolve. And I think the physician lifestyle just fits my conception of an ideal career, especially when working for the betterment of healthcare locally, nationally, and even globally.
Thank you, Freddie. No, thank you all. That was really moving. Thank you all so much. So how about Sage and Nicole? When you were job searching, how did you determine if the position would fit with your mission or calling to the field?
I can jump in first if that's okay, Nicole. Maybe I should have thought a little more succinctly before I unmuted. I think for me, really truly, like when I think back to when I was a nursing student and had no idea what I didn't even know, I think there were different kind of layers of support and types of encouragement and safe and brave spaces that would have really helped me academically first and foremost, but I think also to just like I don't know, connect differently with my faculty or kind of lean into something that felt especially challenging, that I was kind of maybe scared to kind of take that initiative as like on my own. So I think this role, number one, I think healthcare, like I can't imagine a life in any other field. Working with nurses, both as my colleagues and then also as people that I want to support because I care about them so deeply, is important. And then also just thinking back to like the realities of burnout and compassion fatigue, and how for so many nurses and other healthcare professionals, we don't really think about it or talk about it until we're experiencing it in practice. So just the notion of being able to help nurses to develop those strategies and skills and mindsets from the beginning, um, to me, that's like my dream job. And then also all the things that I get to learn, both just, you know, as a coach, as an educator, but also just like as a person. I learn a lot from my students. We have such an incredible, you know, array of students from diverse, like all kinds of layers of identity and experiences. So yeah, I think that kind of is it in a nutshell, what drew me to this position.
Sage.
I think back to the time that I decided to go into this career shift, because really from like being a nurse manager where you're on a unit and you have a team that you're responsible for, I found myself spinning my wheels a little bit. And I don't know if there's anybody who has that experience, but it just felt that there wasn't enough time and there wasn't enough, I didn't have enough bandwidth to do the things that everyone asks of you when you're in a leadership position. And that ate at me because I didn't feel like I was aligning with what I seeked out to do as a nurse, which was to care for others, um, and make a difference. Like when you sometimes when the you know you get in situations where you're answering to a lot of people, you end up kind of losing yourself in that. So when I determined that it was time for a career shift, I was looking for something that would allow me to reconnect with that, initial, like very important part of me that's like, I want to be out there taking care of people, but I also need to feel like, A, I can actually do it, right? And also do it in a different way. So this is not a traditional path for a nurse by any means, but being able to like affect system change. And also you care for patients at the same time. So if we, one of the things that we do is that if there are events where there are system changes that we can put in place, we actually meet with the leaders and we recommend those and we support them in putting those things in place. So there are times where yes, something really bad happened to a patient, maybe that led to a change down the line. And that's also something that as a bedside nurse, you don't necessarily get to do. You might not get the opportunity to ever say, I led a change or I, promoted something that affected patients, not just in my area and in my care, but in the whole hospital. So I think that appealed to me as well, of making more widespread change in an area that is not typical for nurses to necessarily like be in. And also the other thing is I think with my previous career, I didn't have enough time to also dedicate to the things that matter to me that are not just in my job description. And I think I think I can see that in all of you already, but sometimes when you're in healthcare, your job is not just your primary job. You wear different hats and like for me, I'm a big advocate for DEI and participate in a lot of those initiatives here. So this position also allows me the time and the support from my leaders to be in those initiatives. And I think when you're seeking for a job opportunity, it's important that you take the time to realize like, yeah, this is what I want to do. And maybe that job sounds awesome, but is it actually going to feed your soul? Is it going to give you the time to be a person? And I think a lot of us sometimes just like, I wanted to be a manager and I wanted to go into all this leadership stuff because I thought that's what I was supposed to do, right? But you also have to think about like what actually fits you and your life, not just at work but outside of it, and still allows you to fulfill that mission. So I think that's really the biggest draw that I had to this role.
Thank you both so much. So what is the relationship between like the Jesuit core values and whole person care, right? Cure personalis and whole person care. What does that look like for you? This can be an open question for all of you. Does anyone want to kick us off?
I could start off. I think I find whole person care, it's integral to the healthcare mission. I mean, the tendency when we hear the word medicine, the tendency is to focus more on the physical health, physical ailments. But I think we give very little consideration for the other non-physical health components. And this has been like this tendency dates back for centuries, and it's still present to this day. And it manifests in many ways, and notably, I would say the stigma against seeking mental health first aid. I think that's a big stigma in the community. But what's unique about the Jesuit perception, I think they bring something different to the table. Cura personalis, whole person, care for the whole person. After all, I mean, as human beings, we're not limited to the physical. We have the social, we have the mental, and we have the spiritual components that make us to hold us up together, essentially. And health becomes very complicated when you factor all of these components together. And with that said, it seems very reasonable and much appropriate to adopt cura personalis as a mantra, even in healthcare. And I think it would be worthwhile to give a few examples. So the first experience that comes to mind when listening, when thinking about cura personalis, it's when I used during my time in Christian medical ethics. So it's a course that's offered on campus and run by a Jesuit priest, Father Peter Clark, who's the director of the Institute of Clinical Bioethics. And if I remember one thing from that course, that is that patient care is not as clear cut as one would want it to be. I mean, it's very involved and it requires a true and profound understanding of the patient. And that treatment of the patient, if it's not focused on the whole person, it's nothing more than a recipe for failing to administer adequate medical care. Think without truly understanding the patient, we cannot cross that barrier over. I remember many stories from the course, like patients not wanting certain treatment because of the stigma, or not wanting certain treatment because of having to wear visible medical devices 24/7. And at the time, I could see the importance of cura personalis, and what can be better than to listen to that from a Jesuit priest whose career has revolved around ethical medical practices and appropriate patient care. And we have other values too, like being men and women for others, especially with accompaniment and being there for patients and addressing their needs. We have service rooted in justice and love. It's another Jesuit value, and that's integral to the healthcare mission as well. I think the medical profession calls us to invest our time towards serving others and showing care and compassion. And I would argue then that true compassion or true care can't be really achieved without understanding the patient. So patient care requires us to actually care for the whole person, for us to understand that patient. And just the Jesuit values, I think they truly embody the medical mission that we should strive to fulfill, and to be there for patients, to serve them with due dignity and respect.
Snaps, Freddie. Yes, that was awesome. Preach. That was so good. Thank you. That was really beautiful. And I'm so glad that has been, your Jesuit education. And Pete Clark, if you're watching, you're so great. Anyone else want to share a little bit about that? No pressure, but.
Yeah, following Freddie, I've learned a lot also from Father Clark. We've both had him as a professor, and I took Just Healthcare Developing Nations, where we learned about limited resources in developing nations, how you would react to health disparities, and we looked at whole person kind of care. What would you do in a situation where you cannot see or have access to the type of resources you would have here, for example? And going back to what Freddie was talking about, yeah, the medicine here tends to resemble patriarchal medicine, where the physician thinks that they know everything and tends to prescribe or diagnose someone based on their symptoms instead of listening to them. And that's something that I've learned a lot through his class and also through volunteering at Health Promoters, because it takes a lot of effort to actually do the tests and everything, but what's most important is that you listen to the patient and what their needs are. Because if you're just supplementing them with information and not listening to what they can or cannot do, then it's useless, or it's not all person and effective care. So again, with Cura Personalis, we use this value in being men and women for others and providing that care, not only in a way that honors their dignity, but also would lead to better overall health outcomes. So it's a great way where we use it in everyday life, and it would be great to use it as physicians and medical professionals as well.
Thank you, Jessica. Thank you, thank you. Both awesome.
There's just so much wisdom from our students here. So I just want to add two little things. In addition to all that Freddie and Jessica shared, I think there's an element of always remaining curious. That's really important to approach our patients, our clients, our students, all those, our colleagues, those in our care, is to remain humble with again, just always remaining curious, which can be hard sometimes when you feel pressured that you have to know, or there's an expectation that you can fix the situation. As was already said, but maybe just kind of a little bit of a different spin, just recognizing that those in our care are the experts in their own lives. And it's a privilege and an honor to come alongside of them to contribute to their overall health and well-being. I think the other side of that, of Cura Personalis and just whole person care, means that we're willing to advocate, that we are willing to, in the midst of all systems, you know, the system is not always set up. It isn't set up for everyone. So as we're thinking through, you know, our patients, our clients, our colleagues with marginalized identities, as we are all navigating the realities of what's happening right now in our country, a willingness to advocate, a willingness to show up, and a willingness to always learn, to listen, and to stay curious.
Paige, going along that, we have a question from our viewers, from our audience, from our community. So what are your thoughts on Cura Personalis and being persistent throughout challenging healthcare system policies that don't necessarily provide the time to care for the whole person? That's a good question, whoever asked that. That's a challenging question. So I'll open that up to the panel as well.
I'm sorry, can you repeat it?
Yes. What are your thoughts on Cura Personalis and being persistent through challenging healthcare system policies that don't necessarily provide the time to care for the whole person?
I'm gonna attempt to answer this. I think one very obvious part of healthcare, something you find out very quickly as you enter the profession, is that time is very limited. I see a lot of situations where we have physicians who want to be involved in things, and they are, you know, are required to see so many patients a day in order to get paid, and there's all these external factors, from insurance to, you know, your time allotment to do things, and it can be pretty challenging and stifling when you know that you need to make time for certain things that the patient needs, and there are times where you have to push back. For example, you're caring for a patient on the floor, and you know that, you know, there are social factors that are, you know, blocking this patient's ability to get the appropriate care. Maybe you know, you have a situation where you know, some things I've seen on the units is you have patients who are in the hospital who no longer need to be in the hospital, but because we cannot sort out all the social, you know, stuff that's going on, which is not their fault, and you know, life happens. There are times where we are pouring resources and time into patients that, you know, really don't need to be there. But in order to help those patients, for example, get home or get to a better situation, you do have to push against the time, and you know, say like at the end of the day, like you have to look at what is the best thing for the patient. And hopefully you have leadership and teams that are willing to do that. But I think in my role, when we know that we're looking at patient harm, which could be detrimental could cause death. And then on top of that, there's something that we call second victim syndrome, which is when the healthcare provider involved in the case is considered, what we consider them a victim as well of the event. So the alternative is we can cause further harm, or we don't slow down to prevent things from, going wrong. Um, so yes, there are times where we have to push against those policies, and we have to push against leadership of like, I know that this is more time consuming, but this will keep patients safer. This will prevent somebody from making a mistake that then could potentially, end the life and or a career, because people, you know, sometimes cannot even go back to work after some of the events just because of the emotional impact. Um, so I think, yeah, there are time constraints in healthcare, and that's just something to know that will be there. There's a lot of competing priorities, and it is a business. As much as we don't want to think of it as that, it is. And it's important, I think, for me to, yes, I'm working in the constraints of this environment, but how do I still push to provide, whole person care, when that's just the hand that you're dealt?
Thank you for your thoughts on that, Nicole. That was a lot of really good stuff to think about. Anyone else from the panel want to share about that? That's a really good question.
Just really practically, I think it's remembering that you are on a team, and that trusting the other members of the interdisciplinary team, trusting, maybe it's outside of the healthcare system, just really connecting with community resources. So I think it's trusting your team, being aware that you may not always be the one who can fix it or address it, but that you can commit the time and the energy to help form those connections. I think it's also joining committees and advocacy groups, and maybe getting creative to lean into the work from maybe a different perspective.
Thank you. And kind of going off that, another question from the audience. How are you caring for yourself and your colleagues in medicine? And then maybe for Jessica and Freddie, another way to think about this is, how are you caring about your colleagues, like your fellow students in the work? I think that definitely applies to you both as well. Anyone want to kick us off on this one?
I could start off with that. I think, as we mentioned earlier, like we help run community health equity initiatives, so medical clinics. And a point that we like to drive home is always reflection, reflection, reflection. Know the value of the work, know why you're doing this. What's the purpose behind it? This is to see the significance of the work in the community. And frankly, I think one of the benefits of the health promoter program, which is the program under which the clinics fall, I think it's that there's tangible, immediate gratification. You see the patient, you help the patients, you help to get them out of their troubling situations, especially that we're working with very vulnerable populations. And we often see as student volunteers, undergraduate or graduate volunteers, we often see things that may not come across as very friendly, or we may have aggressive patients come in, but still with that, we always try to maneuver around that. We always try to reflect on the significance of that work and seeing how we can build on that, learn from our mistakes and push forward. Again, reflection, mental health, continuously checking our mental health, seeing where we stand, and seeing how we can develop on that. So yes.
Absolutely. I stand with Gen Z on the mental health stuff. Really, Gen Z, you guys have been really so forward on that and caring for that. That's awesome. Anyone else want to answer that question?
I can just add to what Freddie has said. Yeah, so we do reflections twice every year, once per semester. And it really lets fellows reflect on what they've experienced, but also what other people have experienced and the significance of why you're doing what you're doing, and also what other people are doing it for. And then to add to that, there is cooperation that we do inside of the institute as well, and with each team, because it's not possible to do it all yourself, of course, and you learn that the hard way. And we've seen it all, we've all messed up, but it's okay to it's okay to accept challenges that will burden you, but it also requires a lot of assistance. So with these health promoter programs, it's a group of 4 or 5 fellows, and each coordinator has a role in the process. And coming together, it all lets the fellows and the volunteers coordinate in a way that allows patient advocation and also coordination between the fellows in a way that it wouldn't be organized if one person did it all themselves. So yeah, another way that we reflect, and we also do everything in a cooperative manner as well.
Thank you, Jessica. Anything from you, Sage or Nicole?
I think for me, the work that we do can get pretty challenging, especially when we identify closely with a case, somebody that resembles a family member, an event that, you know, we know that could happen to anyone, right? And I think one of the things that we try to do is really check in with each other as a team. We're pretty small. There's like 3 specialists in my team and then our director, but we have a group of people that do these root cause analysis that extend outside of our designated group of specialists. But I think just checking in with our coworkers, like I'm big on the taking your lunches and going on walks and your breaks. And there are times where we're having a meeting and we're going somewhere else. We're not staying in the hospital, because when you're in that environment a lot, you just sometimes you need a bit of a change. And healthcare workers are really terrible at taking care of themselves. So I'm big on just trying to promote, like, us moving away from the desk and just spending that time as people and as a team, because the more you know your coworkers, the easier it is for you to also spot if somebody's really struggling with something, and to intervene sooner. Because, like, yeah, some of these events, like, we deal with like postpartum hemorrhages and all kinds of, just terrible things. So it's really important that we stay connected with each other.
Absolutely. Thank you.
Now we're running out of time, but just really quickly, I think connection, healthy boundaries, and practicing what we teach and preach about caring for ourselves as whole people as well.
Thank you. Yeah, it's ironic. The people who are often in caring positions are just not always good at that self-care. The irony of that is real. Thank you all so much. And so probably for our last question, yes. Yes. Okay. For our last question, I'd love to hear from all of you. And I'm just going to go in the order that I see you. So how about Sage, Jessica, Nicole, and then Freddie? Given the challenges in the healthcare field, what keeps you going?
Remembering that this work is really a calling. It's not just a job or even a profession, it's a sense of calling. I think it goes back to one of our core values, like seeing God, seeing the divine, seeing hope, seeing love beyond our understanding in all things. And even hard days, or even witnessing really hard things, that's just a snapshot in time in the whole bigger picture. So that's what keeps me in it. It's just such a part of who I am, and at the end of the day, I can't imagine doing anything else.
Yeah, I can totally agree. It comes down to what your values are and what you plan to do with those values as well. For myself, it's the hope that the small scale solutions that can go towards a bigger scale. And sometimes it can feel overwhelming and it can feel that you're under so much stress, but it's the gratitude of the patients that keeps me going. Whenever as I can't do much restorative work because I'm not certified yet, but because I'm giving them fluoride treatment, because I'm giving them toothbrushes, toothpaste, floss, I'm entertaining the kids, teaching them how to brush their teeth. That's what keeps me going. And I've built such a relationship with both kids and adults because it's very valuable to me. And growing up, I've always had this sense of humility that I've learned from my parents and my cultural views that I want to showcase and keep on when I do my healthcare education and volunteering.
Thank you. Okay.
I think for me is that the big driver is that no patient should come into the hospital and receive any type of harm from, the hospital or from being in our care. So that's a big driver, right? Like I want to think that my family members coming in to get care, that we will get the best care and that errors will be prevented as much as possible, right? Because we're human. But also this job, like this position, this role really feeds my curiosity and my, because you have to ask a lot of questions. You have to like really go in with humility because I'm getting perspective from different people and I'm not the expert. And that level of humility is really important for me to get on nice dosages. So it just keeps me open-minded, curious, and humble. And I think that's important for for us as people. And it just helps me keep going.
Thank you. Ready?
I think one reason that that I still insist on pursuing like career medicine despite the challenges is my repeated contemplation, of the valuable work that medical professions contribute towards every day. The medical profession puts a smile on families' faces as they see their loved ones being treated and recovering really well. And I'm always also contemplating the potential. By that I mean what milestones I can hit. And the highest of these milestones has always been centered around patient care for me. And aside from the fact that we're in Mission Week, I think the Jesuit education here has really instilled in me a discipline towards a cause and a commitment towards living up to what I'm called to do. And now referring back to the Jesuit value of being men and women for others, I think whatever challenges that arise in our paths and stand in the way of patient access to adequate treatment and physicians not being able to administer such treatment, these challenges should not deter us away from the profession, but rather like encourage us to maneuver around them and to even come out stronger than before. And regardless of the challenges, I think someone who has committed their career or has always been genuinely interested in the medical field, I think they will embrace these challenges and they'll carry on with this mission through ups and downs and through highs and lows.
Thank you all so much for a great panel. It feels like with these wonderful professors, teachers, people in the field, soon to be in the field, that we are in good hands. So thank you all so much, and we hope that you join us for other events during Mission Week. Have a great day, everybody.